Today, I want to talk about a recent report from the WHO, the World Health Organization, which made a sharp conclusion about the consequences of particular healthcare systems used across the world. The report came on April 7th, World Health Day, as an attempt to promote the UN's Sustainable Development Goal that wants universal health coverage in 90% of the world's countries by 2030. This is an extremely ambitious goal, but it's necessary because the status quo and most half-measure alternatives are just unsustainably terrible. One of the more shocking facts in the report is that at least half the world's population lacks full coverage for essential health services, and that about 12% of the world pays more than 10% of their household income on healthcare, which is disproportionately high compared to people who have access to a universal healthcare system. In countries where healthcare systems are mostly privatized and/or the regulatory agencies are corrupted, the cost of healthcare services is astronomical. The United States, for example, is the wealthiest country in the world, and yet Americans don't have universal health care. They have borderline unaffordable care, with the highest premiums in the world, and the highest deductibles, and they're the victims of fraud and insurance abuse that doesn't exist to nearly the same degree in any other modern country with a functional healthcare system. In fact, healthcare in America is so expensive that trying to pay for medical bills is the #1 cause of personal bankruptcy. It's so expensive that more than 40,000 American citizens die every year because they can't access or afford healthcare. And add on top of that all of the preventable diseases that end up getting worse because the person who has them is afraid of the medical bill of going to the doctor. They're afraid of getting a checkup or getting things looked at or getting their teeth taken care of because they're afraid of the bill, because all of this stuff is prohibitively expensive. And that just ends up making the problem worse for everyone, because the people who have these health problems, they're not getting diagnosed, those health problems get worse. And by the time they're forced to go to the hospital because the problem has gotten so bad, it takes extra resources and extra doctor's attention and time and care, and it costs a lot more money to get this preventable problem taken care of. So the whole thing is just a giant foobar mess. It's terrible. And yet, despite the cost of all of this, our average health outcomes aren't particularly that great. We pay more per capita than any other modern country in the world on healthcare, and in return, we get relatively mediocre outcomes. I mean, sure, if you're wealthy, you can afford top-notch care anywhere in the world, and if you're wealthy and you have some rare disease that requires specialty care, America has some of the most top-notch doctors that will be able to give you that top-notch care. But the problem is that this top-notch care is simply out of the price range for the vast majority of American citizens. This whole situation is totally 100% unacceptable, especially in a country that considers itself developed and modern. Rüdiger Kresch is the Director for Health Systems and Innovation at the WHO, and when talking about the state of healthcare across the world, he said, and I quote, "Today, about 100 million people fall into poverty because of health expenditure," unquote. To support the WHO report's conclusion that universal healthcare systems are objectively superior at providing affordable medical care, Kresch also said, and I quote, "It is not just a matter of money, but of political will, of political choice. So you can afford health coverage for everyone, even if you are not one of the most affluent countries in the world," unquote. When talking about the cost of healthcare in countries without universal healthcare, Kresch said, and I quote, "We call these catastrophic health expenditures because people are losing their fortune because they had a big accident or an open heart surgery. So this still pulls people into poverty," unquote. The WHO is basically advocating for the widespread adoption of universal healthcare systems for the sake of the health of the world's citizens and for the sake of their financial security. Officials said that they don't think they're actually going to meet the goal by 2030, but that it's more important at this point to focus on generating the political will and the social demand for universal healthcare systems.